Our lecture is about viral hepatitis. Yes, we spoke about hepatitis A, B. Now we will speak about hepatitis C, HCV infection. At first, let's speak about the viruses of hepatitis C. So it is hepatitis with parenteral mechanism of transmission, and you see the constructure of the virus C. So you see the structure of the virus, lipid complex of membrane of the virus, RNA of the virus, core proteins of the virus, non-structural proteins of the virus. So genes of the virus is the ribonucleic acid, etiology and epidemiology of the virus, as in hepatitis B, so it is parenteral mechanism of transmissions. And ways of transmissions is blood contacts, syringe, blood transfusions, transplantations, and sexual ways of transmissions. So virus C is very changeable virus, mutation characterized by mutation abilities. So and there are 6 genotypes in the world, but in Russia more often we indication the first and third genotype of the virus. So virus characterized by very changeable abilities. So it's characterized by weak immune response of infection, and the virus cause replication in macroorganism, infected new cells. It causes the progressive of infection, formation of chronization of infection, and then formation of fibrosis and cirrhosis of the liver. So more often of the patient with C hepatitis cause the formation of chronic forms of infection because mutation of the virus, prolonged forms of viremia, and chronization of infection. Only 20% of hepatitis who cause recover, and are also and others cause chronization. What about pathogenesis of hepatitis C? Blood contacts, viremia, mutation of the virus, disorders of immunogenesis, weak immune response, synthesis of antibodies, but antibodies don't recognize the virus, and virus replication in hepatocytes, immune cells, endothelial cells, activation of autoimmune mechanism, synthesis of autoantibodies, synthesis of immune complex, destruction of target organs, formation of target organs, for example, thyroiditis, myocarditis, vasculitis, arthritis. So, chronization of infection, prolonged viremia, activation of mechanism of fibrosis of the liver, and formation of macronodular cirrhosis and formation of cancer of the liver. Let's speak about clinic of infection. Incubation periods from 12 up to 26 weeks. And it's characterized by prodromal period. Prodromal period characterized by asthenia, dyspepsia, arthralgia, general malaise, combined variants. Then period of jaundice. Period of jaundice lasts from some days up to some weeks. Disorders of the function of the liver, destruction of hepatocytes, disorder of the function of hepatocytes, formation of hyperbilirubinemia, cytolysis, and so it's characterized by syndrome of jaundice. It's characterized by hyperbilirubinemia, cytolysis, formation of focus necrosis of the liver. Sometimes, and syndrome of jaundice characterized by icterus of mucous membrane, icterus of sclera, icterus of skin of the patients, hepatomegaly, splenomegaly. So sometimes increasing of bilirubinemia and cytolysis, and then recovering of the function of hepatocytes, connection bilirubin and excretion of bilirubin to bile ducts, and recovering of the function of the liver. Then period of the crisis, and then period of recovering in 20% of the patients, who formation of recovering, and normalization of function of the liver, synthesis of antibodies, elimination of the virus, period of recovering characterized by stabilization of clinic and decreasing of the level bilirubin, transaminase, and function of the liver. So, and we spoke that more often patient cause chronization because mutation of the virus, because non-adequate immune response, when antibodies don't recognize the virus and virus replication in different organs, and formation of chronization of process, chronic hepatitis B. And in 80% of the patient, formation of chronic forms of infection. And chronization of infection characterized by activation of synthesis of fibrosis, cirrhosis, formation of cirrhosis of the liver, and liver insufficiency. But there are two variants of chronic forms of hepatitis C. It is the chronic forms with active replication, when we indication HCV of the virus in blood, and chronic forms without active replication, when we don't indicate RNA of the virus with negative results replication of the virus. Markers of infection. So we indicate the antigen and antibodies markers of infection. In acute period of infection, on the first days of infection, we indication anti-HCV core IgM and HCV RNA of the virus by polymerase reactions. So it is markers of active replication. And when markers of active replication keep more than 6 months, we think about chronization of virus C, of hepatitis C. Next, anti-HCV core IgG, it is the markers with of the markers of infection and antibodies G synthesis on 3rd and 4th weeks of infection. So antibodies to non-structural proteins of the virus, anti-HCV NS3, anti-HCV NS4, anti-HCV NS5, so they are antibodies to non-structural proteins synthesis on 6 weeks of infection. So anti-HCV core G and anti-HCV NS 3, 4, 5 keep in blood for a long time, more weeks after infection, in period of chronization, in formation of past infection. Those antibodies keep in the blood of the patients. So, and it can characterize the past infection of the patient. So, in cases of chronization of hepatitis C in blood, we can indication all those markers of infection. Yes, it depends of active replication of the virus. But all those spectra of those antibodies we can indicate in chronization of hepatitis C. And what diagnostic of hepatitis C? We must know anamnesis of the patients, parenteral anamnesis, so blood contacts, syringe, sexual, so medical manipulation, stomatological, gynecological manipulation, tattoo, cosmetic manipulation, so factors of transmissions of the virus C. So, in hepatitis C, more often we indicate mild and moderate forms of infection. And so there is no severe forms of infection. There is no fulminant forms of infection. There is no acute liver insufficiency. But we know that 80% of the patients cause chronization, yes, and formation chronic forms of infection. Only 20% are recovered. So, treatments of infection, yes, we know about high risk of chronization, and in acute phase of hepatitis, C, we can administer antiviral treatments. We recommend in acute phase interferon treatments plus ribavirin, combine of antiviral treatments, alpha interferons plus ribavirin. Dose of interferons 1 million per day during the first week, then 2 times per week, plus ribavirin. Dose of ribavirin 1020 milligram per day in adult patient. Antiviral treatment lasts 3 months. So, antiviral treatments in acute phase prevent chronization of infection. But sometimes the primary diagnostic of hepatitis C may be in chronic forms of infection, and we reveal in the patient markers of hepatitis C, and we diagnosis of chronic forms of hepatitis C. So in cases of chronization of hepatitis C, when we indication the virus in blood, we recommend antiviral treatments and original medicates declinase and Vicaira. Declinase and Vicaira. There is very effective antiviral treatments and effective in 99% of the patients. And antiviral treatment lasts 12 weeks or 3 months. Sometimes patient you can use generics, sofosbuvir, the clotasphere, and so it is generics. There is no registered in Russia. So basic therapy, infusion therapy, holykinetics after crisis, ursosan, Giptral, pathogenic therapy, enzymes, vitamins, probiotics, metabolic treatments in chronic forms.